Hi, I'm Dr. John Barras. I'm a cosmetic dentist here in Houston, Texas, and I'm here to talk a little bit about botched procedures, dental procedures that are done for smile makeovers or veneers. And we've been doing this for quite a while. Most of the time I see a botched procedure, it's because someone went to another dentist previously because their teeth were breaking or cracking, and the dentist simply put some veneers which masked any of the problems, and short term looked pretty good, but long term what we find is that if how the upper teeth and the lower teeth, how they relate to each other, if they're in a bad position and you're breaking down your natural teeth, then it's clear that anything like veneers put it over those are eventually going to break down over time. And it's quite a significant investment to have that break down. So I got a fellowship in neuromuscular dentistry and went to school 3 or 4 years after dental school in order to help treat patients with their bite and cosmetics and smile makeovers and all of that. So it's important that the bite is in a good position first, then you can do the cosmetics to make it exactly how you want. So in my office, if somebody calls about botched dentistry, we'll have them come in, we'll take photos, we'll really examine the bite, we'll run some tests that test muscles and determine if you're in a bad bite before doing any corrective work. If you're in a bad bite, we'll do some things such as orthotics to get your bite in a good position. Once your bite is in a good position, then we can really address the botched dentistry and get it all corrected so that the problem is solved, and aesthetically we can get the teeth in a really good place and functionally as well. So when we looked at botched dentistry, we also want to look at what you really want, the size, the shape, the color. We're going to take shade tabs and see, is it a color thing that you want to change? Is it a size thing that you want to change? Is it a shape? We'll address all of those in this workup time. We'll take impressions of your teeth. We'll send it off to the lab to make sure that we get the size, shape, color, everything that you want. Now we're ready at this point to take care of the botched dentistry. So we can take off all the botched dentistry. We can put on the new temporaries or provisionals based on what the lab has come up with, based on what you want size and shape wise. From that point, then you can go home for a couple of days and get used to what you're in at that point. If there are any changes that you want to make, then we'll have you back. We'll modify the temps or provisionals that are in your mouth and send that to the lab. Finally, the lab is able to make the porcelain veneers or crowns or smile makeover, any of the botched dentistry that is corrected at this point. And now the porcelain is ready to go on. We cement it on, and then you're ready to go. And so that's how we correct botched dentistry. We have to correct the function and marry it with the aesthetics. If you have any questions about botched dentistry, cosmetic dentistry, or neuromuscular dentistry, call our office at 713-993-9814.